Hello, everybody. How are you? I'm Vanessa, and I'm going to go over my community sites. I'm glad that we're at the end and that we've made it to the end, and it's been a very enjoyable time, and I've learned a lot. And I really liked this class because we had so many projects to do, and they were really good projects, and I feel like I learned a lot with the projects that we were doing. So I did my community visit on I'm going to go over my geographical community first. My geographical community is around one of the main streets here in El Paso, Lee Trevino, which is there's a lot of population around that area. It's the east side of El Paso, where the Vista Hills Country Club is, and mostly Hispanic population, all ages. Pretty economically stable community, but throughout El Paso we have economically disadvantaged and economically stable people within all parts of El Paso. We don't have a certain part that's really just a certain population. Most of the people in El Paso are Catholic or Christian. We have many different healthcare offices in that area, so that's why I chose that. We also have a high school, so there's a lot of teens in the area, and it's a very busy area. So I thought it would be a good area to choose. My aggregate community is pregnant women, and I'm discussing the incidence of pregnant women that are obese before pregnancy, and also women who become obese during pregnancy. So if they have a BMI of 25 to 29.9, they're overweight, and then if it's greater than 30, it's obesity. A lot of women do develop obesity during pregnancy, so I thought that was a good community to choose. So my first, I wanted to focus on sites that will help my population. So I focused on two sites where I thought were very good for my population. The first site that I used was WIC, which is Women, Infants, and Children. It's a clinic. It is on Lee Trevino, around my geographic community. I interviewed Erica Garcia, which is she's a public health specialist, outreach coordinator, and she's very knowledgeable to everything that they provide our members and our community. If anybody ever needs anything, she would be the person to go to for WIC. WIC does nutritional assessments. They do iron screenings on children and pregnant women. They provide healthy food during pregnancy. Also, they provide healthy food to the children when they start eating. They do have one-on-one counseling with nutritionists, and they have nutrition classes. They have breastfeeding support as well, which is really good because we do want our mothers to breastfeed to make sure that our babies are healthier, and it does help with the obesity in children as well. So they usually provide healthy foods for children under 5. And so the healthcare level of WIC, I personally think it fits in all categories: primary, secondary, and tertiary. Primary because the resources that WIC provides help prevent disease and problems. Secondary because it can detect like low iron, or it can detect a high BMI, and we can assist in preventing or worsening the progression of the disease, which I'm focusing on obesity. So WIC can really help with that because they do provide the healthy groceries. And most people do use the healthy groceries that are provided to them. And it's not like food stamps that you can buy whatever you want. This just has to be strictly like 1% milk, beans, healthy cereals. They also provide fruit juices, and so it has to be healthy foods. Tertiary because it can help with underlying problems and also correcting the diet and providing education. So we can improve health in the community by doing that, and also making sure that the community is eating right in order to prevent diabetes and high blood pressure. And I do always refer my patients to WIC because I do work with a pregnant population, and I do want them to get WIC to help them. Most of my patients are Medicaid patients, so that's one of the benefits that they have. WIC is something that will really help them. My second community site was Dr. Yolanda Lagunas. She's an OB/GYN, and she also does have a nurse practitioner in her office working part-time with her. Dr. Lagunas is a wonderful OB/GYN. She has a low C-section rate, and she does specialize very much in making sure that women are eating right and keeping nutrition. She's very strict on the weight, on how much you should gain, how much you should not gain, and what you should eat. And if you listen to your certain cravings, because us as Hispanics, sometimes we think that if we don't have if we have a craving and we don't fulfill it, something bad will happen or something like that, which is not. Like, we should be eating healthy during pregnancy. She cares for the women. She does preventative health. She does prepubertal health. She does prenatal care, postpartum care, and she's one of the lowest in El Paso with the low C-section rate, which is awesome. She will not do a C-section unless it's very, very necessary. Dr. Lagunas does like for her patients to not gain more than 25 pounds if they don't need to during pregnancy. And if you're already overweight, she just is very strict with you on how much she wants you to gain. So she does provide that education on the nutrition part of the spectrum. Also, I think that her practice is primary, secondary, and tertiary as well, because she performs annual pap smears. She helps reduce the incidence of cervical cancer with that, and early detection. Secondary because I think she can detect problems like such as STDs, infections, and then she can treat the patients and the partner in order for it not to get out of hand. And tertiary just because there is people with underlying problems, like maybe they have HPV, which can lead to cervical cancer, and she can stop the progression, or she can help to correct that. Also correcting the problems with diet and providing education on that. To improve our health, she teaches pre-pregnancy nutrition. She does interventions for women who are obese or overweight during pregnancy. She educates on gestational diabetes, hypertension, and risks to the baby and mother when the mother is obese. Since they have so many risks by being obese, one of them is gestational diabetes, which can lead to the baby being too big and then a shoulder dystocia or a C-section. And we really don't want that, because also the baby can be diabetic when the baby's born and have multiple problems as well. So we need to make sure our patients are meal planning and healthy eating habits. The websites that I chose, we can for Dr. Lagunas, we can I can refer patients to her, but I really can't just refer to her. It has to be like in general. So because I can give them a list of OBs in the area. My websites were a little bit similar to what we've already talked about. My first website was using the SNAP benefits, and that's just using the TANF, the emergency money that they can use if they don't have money for food, or also providing them with food pantries. And then it also covers WIC and Medicaid and CHIP. which they can apply for and get everything paid for that they need. The SNAP helps with families that have little or no money to buy food. The TANF cash is an emergency income for basic needs. And then they also help with domestic violence, disaster, and filing taxes. It also can be primary, secondary, and tertiary care. Primary because the SNAP can assist patients with basic needs and to help prevent diseases. Secondary can assist patients that already have problems to not progress with the disease. And then tertiary because it could prevent from not having any food or money for basic needs, which we all need. And some of the ways that the website can help is it could decrease obesity before pregnancy, it could decrease obesity during pregnancy, and postpartum weight loss. Making sure that our patients are having prenatal care and counseling about nutrition and healthy BMI with their doctors. And then also discussing the risks, of course, with being overweight. So my second website was the American College of Obstetricians and Gynecologists, ACOG. They provide guidelines to physicians, so they provide resources to physicians. They also provide resources to patients, and we can email them or we can print them out for them. They also specialize in all issues that during pregnancy that a woman would need help with or before she gets pregnant. A membership can be purchased by a healthcare provider, and they can educate themselves on various women's issues. There's different programs. There's FAQs on the website. There's different topics. One of them was the obesity during pregnancy, and it can help with meal planning and nutrition. This is also considered primary, secondary, and tertiary, just because primary, it can give you the resources you need in order to not be obese. Women that are already obese, it can help to slow the progress and make them maybe lose some weight. And then tertiary, just to prevent deteriorating in the different multiple disease processes. They do have an obesity toolkit where the patient can look at. They have different resources for pregnancy and obesity, and then and they provide journals and resources for pregnant women as well. I would refer patients to this website to look at the problems and the needs, just so they can see exactly what I'm telling them is true, that obesity does cause many problems during pregnancy and after pregnancy. And we can just print them out information, email it, whatever the patient needs. They do disaster planning, and here in the area, for disaster planning, they use different facilities and then they contract hospitals and employees. They assist with taking vital signs. And we can also give the members like food pantries in the area. That will be very helpful because some of them just don't have money for food. Also, some of them just don't know what they should eat. So providing them with a meal plan or like a food pyramid on what they should eat, on how much of it they should eat, will really help them, especially during pregnancy. Well, I hope you liked my presentation, and I'm glad that we're done with the class, and I really enjoyed this class. Hope you guys did too, and just more accomplishments for us in the future, and hopefully we can get our patients the resources and the teaching they need to excel. Thank you.